My name is Tim Hort, and I currently live in Lexington, Kentucky. In the late summer of 2022, I was diagnosed with multiple myeloma. It was a devastating, bit of devastating news, but it's almost a couple of years now, and things are going quite well. Um, my family has been very supportive, and we're trying to make the best of it as we can. I actually feel I was asymptomatic. Uh, so in the late summer of 2022, I turned 60. Um, I had never been in a hospital for any form of stay up until that point. I broken bones and gone for stitches and things like that, but I've never had a hospital stay. For about a year prior to that, I was having a lot of stomach problems, but they were not very consistent. They were sporadic and sometimes 4 months apart. And in actuality, it has nothing to do with my cancer diagnosis. So Friday night of Labor Day weekend, it was about 3 o'clock in the morning, and I was in excruciating pain, and I was trying to figure out when I should wake up my wife to go to the hospital. So finally, about 5:30 or so in the morning, we drive over to the emergency room. They went through the normal questions, asked where the pain was and everything, and said, do you still have your gallbladder? I'm like, yeah, I do. Push comes to shove. It ends up being a severe infection in my gallbladder. And while I'm there, they're running all the tests. They put me on some heavy painkillers, and we wait, and they come back eventually after quite a number of hours and say, okay, we've run our tests. We've contacted a surgeon. We've scheduled, we've determined that your gallbladder is very infected. You've got several severely large gallstones, and tomorrow we'll go in for surgery to have those removed. And by the way, while we were doing your CT scan, the technician noticed some things, so we will be contacting our oncologist on call to come in and have a discussion with you. We see some lesions, and we think it might potentially be a few things, one of them being multiple myeloma. At which point I looked at my wife and I'm like, did he just say they're going to bring an oncologist in? It's like completely random out of the blue. I was released and then scheduled to come back a couple of days later for a bone marrow biopsy. They did the biopsy, and then I met with the oncologist, and he said the results show that, from what you see, you have about a 25% coverage in your bone marrow. So we're going to start scheduling your treatments. I'm 60 years old. There are aches and pains in your life. My back has never felt great for 15 years. I don't think I would attribute any of that to my diagnosis. I was fairly early. I believe he calls it stage 1. You just get dumbfounded to begin with that somebody would say that to you. I'm like, how can I have a cancer diagnosis? I feel, other than my gallbladder problems, I feel perfectly fine. I mean, didn't feel tired, really, didn't feel anything like that. But then you start worrying, of course, especially when, you start talking to your doctor, the oncologist, and I started meeting with a secondary oncologist. So I have my primary oncologist who does my treatments. And then I have a secondary oncologist at the University of Kentucky, where they decided that it would be best to do my stem cell transplant.
Day 0.
Day 0.
You ready?
So when I met with them, and it's a teaching hospital, so they've got fellows and students there and everything while you're being diagnosed. And, they can be pretty frank about some things as well. They didn't really sugarcoat much when they talked about, what you can expect from this, and how, myeloma is not curable. They can basically prolong things for a while, but inevitably And as the fellow put it, this is going to end up being what causes your death eventually. Obviously, something comes along in treatments and whatnot, or you get hit by the proverbial bread truck. This is going to be what, and it really messed with my head. It after having a full life of good health, somebody telling you that, this isn't going to last much longer, maybe, kind of put me in a downward spiral.
Bone marrow biopsy number 2 in the books. A little rougher than the first one, but I think we did okay.
They started me off on the Revlimid, Velcade, dexamethasone treatment. So I was on that. So I was treated twice a week, Velcade twice a week, and then Revlimid 14 days on, 7 off, up until the end of December, actually mid-December, when I started having a reaction to Revlimid. I ended up with a full body rash, well, 3/4 body rash from my chest down, and it just like within a day, I started noticing a little stuff over here, and then wham. So they stopped that. I was also not reacting to it well enough. My protein levels were coming down very slowly, much slower than they really wanted to see. So at the beginning of the year, they moved me over to a Darzalex, Caprolis, dexamethasone treatment, which I actually liked a lot better because it was only once a week, and then you got like a week off and whatnot. But I reacted to that much better. I came down very quickly in protein levels. So by April, I had slotted in for a mid-May stem cell transplant. So they stopped my treatment at the end of April. A couple of weeks to, start getting ready for the transplant, have your chest catheter put in and do the tests that they require to make sure you're a valid candidate for the transplant, which I was. And then went in for chemo with Melphan, and then had the transplant the day after that. Stem cell transplant it sounds like a severely complicated procedure, but in reality, I was amazed at how not easily, but uncomplicated it can be. So what we do is we extract stem cells from your blood. They are then stored in cryo, so they're frozen. Then you're given a high dose chemo, which then kills basically everything in your bone marrow. You go back in you go in for transplant the day after, in which point they reintroduce your frozen stem cells back into your body, and then they are basically replicate or grown. You're given some other medications to agitate them quite a bit, so they replicate fairly quickly, and then it raises your white count, your blood count, red count, and such. The idea here is that when you're reduced to the level that myeloma is fairly undetectable in your marrow, and then the new cells are reintroduced, it will help combat them from coming back. So the process itself, again, not ever being in a hospital or anything, I'm going thrown straight into things like bone marrow biopsies, apheresis, where they cycle the blood out of your body, extract the cells, put it back in, and that itself is like a 5-hour procedure for 3 days each day, where you're just lying there while it's done. That was freaky, to put it mildly. And then the transplant itself, so you have a chest catheter in, or I had a chest catheter in, and then they just pull out your stem cells again in a big syringe, and they just start reintroducing them into your body through it. I was starting to feel really good. And in fact, I mentioned I felt like I was cheating, because I'm like, I should feel worse than I do at this point. But I had just started treatment again in the middle of July. I still feel good. I get tired. I have neuropathy, shins on down. So that, I mean, that's bothersome, but I'm perfectly capable of doing all the things I like to do. I ride all the time, work around the house and such. So, and my wife has celiac, um, and we don't do a lot of processed stuff because of that. And because I mean, I make bread for her, I make all kinds of things like that. So I feel like also eating correctly is paramount to making sure that you recover well. Like I said, no processed stuff, lots of vegetables, lots of we eat a lot of beef. I get a lot of protein that way. Um, we don't do pork and chicken and whatnot. It's just beef. So I think that, like I said, had a lot to do with how I feel. I can usually tell when I don't think I eat well how badly it makes me feel now. End of July, I started my maintenance program, as I mentioned. So I'm on Darzalex Fast Pro once a month, and then every third month is Zometa. I'm guessing it's going to be like that for a bit more. For me, it's a sub-Q shot. You get kind of used to it. It's a belly shot. Nobody's favorite thing to do, and it, like I said, it leaves me feeling flu-like for several days. I also get a high dose of dexamethasone on those days, so that you get that lovely steroid reaction. You learn that it's just going to be a part of your life. For instance, like I mentioned, I don't mind doctors, and I've always had blood drawn and whatnot, but it's still a bothersome experience for me. And no matter how many times it's done, it's still a bothersome experience for me. But it's just something I'm going to have to accept as part of my life from now on. And at some point, somebody's going to say the numbers are jumping back up again, and we're going to have to start all this all over again. And I've accepted that that's going to happen sometime in my future. Hopefully it doesn't happen for a while, because there are some things, that I still want to do.
It is an absolutely gorgeous day out here today. I just got done with a walk and feeling really good. Day 75.
But I wish, do I wish that they had the things in place to eradicate? Sure. But I know that they don't. And I mean, just like most other cancers, there's really not much you can do about it. Fortunately, they've got enough treatments in place that, as my oncologist refers to it, he says it's just a treatable illness right now. So I mean, there are others out there that are less fortunate in that respect. So it's kind of a two-sided sword there that you have to deal with. It does get to you at the point where you start wondering, do I have everything in place that I need to have in place? That's part of the spiraling that I think happens right after diagnosis. It's like, okay, now my kids, my wife, all that kind of stuff. What's gonna happen there? But as I mentioned before, I'm very fortunate. My family is extremely supportive. My wife has been a trooper through this whole thing. I guess it's one aspect of my personality that has always been with me in my whole life is, you can have daunting things happen to you, whether they be financial or, family or medical or anything like that. And you can give up. There's that possibility that you're just going to throw in the towel and just, not do anything. My doctor gave me the choice at the beginning. It was either, listen, here's a couple of different pathways we can take. We can do treatments like you're doing continuously, and then when your numbers go down, we can put you on a monthly and hopefully maintain it that way. Or we can get your numbers down now, go through this stem cell transplant, and hopefully that will add a number of years onto the end that might not be there if we just did treatments without a transplant. Now, he really didn't have the numbers to back that up. They're not far enough into, I think, the collective that they can really show one way or another. But it's, again, I mean, it's a daunting thing to think about, the transplant and what that might mean. But it was the best avenue, it seems, to get the best quality and length out of what time you have. I'll be the first to admit there are days, so I'm still, because I've been doing this for so long, I still plan out training plans for my riding, even though, there's really no end goal other than being able to do it and such. And there are days when, I have something planned, a workout and whatnot, and I wake up and I'm gung-ho, but by midday, it's just like, it's just too overwhelming, and I can just sit on the couch, and that would be perfectly fine. I have trouble riding for the couple of days after my treatment, just due to the fact that, because it's an abdomen shot that they give you, so cycling and bending and whatnot make it sometimes a little uncomfortable. So I just usually plan on not doing anything at that point in time. But I think more than anything, it is doing something for yourself that can help you build strength, both in mind and in body. That is just paramount for me. And I just like being out there and just doing something for me. I don't have to think about work or any of those things. I can be out there just enjoying sunshine and wind and sometimes rain. Lean heavily on loved ones, family, and such. A lot of people, myself included, are very much, I should be able to handle this myself. I shouldn't have to bother other people for something that is my responsibility, meaning it's my illness, it's not their illness. Why do I have to bother anybody else about it? This is a disease that is usually not caught until it's pretty far in, until the point where you can't walk, or you break a bone bending over, or turning over in bed or something like that, because your bones have been eaten away by the disease. At which point, it becomes so much harder just to do anything about it. If you've just been diagnosed, don't be afraid to rely on those around you to help you. If it hadn't been for my wife helping me with these things, I don't know what I would have done. You've got to look for hope, and you've got to look for help.